The first layer of assessment is by the parent. They're going through the checklist every day. If they're not feeling good, they're staying home, and they're coming to school when they don't have a temp or any symptoms. But if your child would happen to have a symptom during the day, they would be assessed by the school nurse, and with their symptoms and talking to the parent to see if there was any exposure, we would then decide if it's a suspected case. You know, I get a kiddo in here at 1 p.m. He's been here all day. He comes down, his teacher sends him down, and he ends up having a fever and a sore throat. Those are two symptoms that could be COVID. Immediately, I'm going to do a head to toe, like I normally do with kids when they're not feeling well. I'm going to put them in what we have, each clinic will have a designated isolation room, and just like a sick room. So we're trying to keep kids that would be not sick, but they're just a skinned knee, away from the kids that are possibly contagious. So we have that separation in each of our clinics. I would put them in there. I would talk to their parents and go through the history on if they've had any exposure. And then we would have that kiddo, that parent picked up the child, and then they would follow up with their pediatrician, their physician, to then do that next step. So if it's testing, we highly encourage them consulting with their physicians on these kind of things. That kiddo with a fever and sore throat could just be strep throat. There's other illnesses that are going around, colds, strep throat, the normal stuff that we see with kids. But it's really up to that healthcare provider. When we see those symptoms, we're going to be careful, and we're going to send these kids home and to be evaluated. But it's up to those physicians to do a good look and decide the next step. We have our existing illness guidelines. You guys know those. It's fever, vomit, diarrhea free without medication before coming back. So when you've hit that, so if he does have strep throat, we're going to follow our existing guidelines. We're going to, he's going to be on antibiotics, and he's going to follow that guideline for exclusion. So maybe he's back in 2 days once he's feeling better and he's been on antibiotics long enough. Probable case means that they fit in that those category 1 or category 2. So category 1, they have one of those symptoms. So they have shortness of breath, they have a fever, they have a cough. Or if they are in category 2, they have two symptoms. So maybe they have a headache and a sore throat together. And then they also have a known exposure to COVID. So that person would have to go home, seek guidance from their healthcare provider for a test, possibly for COVID, and isolate for 10 days. And they could come back to school once their symptoms have resolved and they're fever-free for 24 hours or more without medication. If there is a positive case, then we look to see who the close contacts were, and we notify them, and then they are in quarantine after we've designated or figured out who those close contacts are to that positive case. Close contact is anybody that has been within 6 feet of that positive case in a 48-hour period for 15 minutes, with or without a mask. So if your child was around a positive case on Monday and Tuesday, and if they had 10 minutes with that person within 6 feet, and maybe 10 minutes on Tuesday within 6 feet, that's a cumulative amount of time, and that would be considered a close contact. So then that person those close contacts would quarantine for 14 days at home, making sure that they're staying in their house and they're being separated as much as possible from other family members, so that they have their own bathroom and bedroom if possible, so that they're staying safe at their home as well. Coronavirus, you can develop symptoms even far into, so you may not have symptoms, or you may even got tested on day 2. We send your kid home we're saying they're a close contact, they're supposed to stay home for 14 days. Even if you get a test and the test says negative, you have to continue those days because you could develop symptoms within that time frame. And so the health department is asking us to maintain that quarantine for all of us to be safe. If your child's in a classroom that had a positive case and that your child never came within 6 feet of that child, maybe that the positive case is in the back of the room, your kid has been in the front of the room, there's not been that 6 feet, 15-minute guideline, then your child would not be considered a close contact. But just so you know, we're taking those kids out of the classroom, we're cleaning the classroom, we have flex spaces in our schools to put the kids so that we can thoroughly clean the environment before putting those kids back in the classroom. And there would be notification to the parents at that point. The health department wants you to give that 10 days of rest and isolation at home. As the point of contact for Sycamore schools with the health department, I have a contact tracer at the health department. So I am sharing with her these cases that I get, and then we are determining who is a close contact or a probable or positive case. To return to school, you would need that, and I would help you with that. I would assist you with that. So I would be your point of contact. You would need a release letter. If you were probable or positive, you would need a release letter from the health department to come back to school to make sure that everything is okay, because they're supposed to be keeping up and contacting those positive cases to make sure they're doing well and they know the date that it's safe to come back. As far as a close contact, we would be giving you a letter that tells you the anticipated date of return. A couple of days before that, I'm asking families to give me a call or to email me, and we can discuss how your child's been during those 14 days and if any symptoms came up during that time. Because if there were symptoms of COVID, then we would want to go down that path and make sure that they were, that they've contacted the health department or their health provider, and they've got they've talked to them about that process. But if all is fine and they've been asymptomatic and they've hit their 14 days, then they return to school, and they will have that on a letter saying when their anticipated date of return would be.
Okay.
We have our building nurses there to go through these scenarios, and not everything is going to be black and white. There's going to be a lot of gray, and there's going to be individual cases that we need to look at. Your building nurse is there to help you through that, and they are going to then consult with me and collaborate with me on these things. And so I can also be a source of information for the community as well.